Your vaccination status will now determine the length of your isolation period once you test positive for COVID-19. Based on the Health Department's proposed guidelines, fully vaccinated individuals who have mild or no symptoms will only be required to isolate for 7 days. The count starts on the first day of symptoms. But if asymptomatic, day 1 starts on the testing date. If partially vaccinated or unvaccinated, isolation period remains at 10 days. But those with moderate symptoms will be required to isolate for 10 days, regardless of vaccination status, and 21 days for severe and critical cases. For fully vaccinated close contacts, quarantine is cut to 5 days, but they have to monitor themselves for symptoms, while the quarantine period for unvaccinated or partially vaccinated close contacts remains at 14 days.
Evidence review of our living CPG also shows that the average duration of infectivity and secondary attack are relatively lower for vaccinated than those unvaccinated individuals. Vaccinated individuals had lower chances of spreading the virus within their household and close contacts. Vaccinated asymptomatic and mild cases are unlikely to shed infectious virus 10 days after the diagnosis or symptom onset.
An even shorter quarantine period of only 5 days is required from asymptomatic fully vaccinated health workers exposed to COVID patients, and if needed, may even be cut if the health worker has a booster shot, subject to IATF approval.
This shall also be expanded to other sectors with strict industry standards on infection prevention and control, subject to the IATF approval. For example, we have ongoing discussions with the aviation sector.
For COVID-19 testing, priority are senior citizens, persons with comorbidities, and health workers.
This is because those above 60 years old or with comorbidity can be provided with different medicines or antivirals within the first 5 days of their symptoms.
We prioritize, given the limitations of our testing capacity at the moment, we will prioritize those who will benefit from the testing.
A COVID-19 test is optional for asymptomatic close contacts, but they have to monitor themselves for symptoms. If they need to be tested, this should be done on the 5th day from exposure. Carolyn Bonquin, CNN Philippines.